I want to conclude this section on substance abuse by just talking about substance abuse among physicians. You need to know that data tells us that physicians are notoriously really bad at detecting substance abuse in patients. If a substance abusing patient comes to see a surgeon or OBGYN, only about 25% of them will actually be able to detect there's a substance abuse problem. Even psychiatry, where you'd expect them to be really sensitive to these issues, only gets roughly 65% of the substance abuse cases they're presented with. Almost all physicians miss substance abuse if the patient is a woman, especially high SES, and by the way, here, other physicians. And so I want you to think this way on the exam question. If you're presented with a patient having difficulty, female, high SES, especially another physician, if you're not considering substance abuse as an explanation, I didn't really get through to you here. Now, I want to have you overcome a prejudice. When we talk about substance abuse, substance abusers, many people think substance abusers are out on the street, unemployed and unemployable. The fact is that most illegal drug users are employed full-time. Most illegal drug users are holding down jobs. That's how they're in fact getting the money in order to buy the drugs they're using. I remind you, as I said previously, physicians are licensed by state medical boards. Therefore, physician impairment issues, including substance abuse problems, are dealt with by the state licensing board. Let's say on an exam question, you're presented with a colleague who you decide has a substance abuse problem. If you have a colleague with a substance abuse problem, what must you do? Well, you must do three things, and crucially, in this order. If you see all three options listed, you have to pick the first one as the right answer. The first thing you must do with a colleague that has a substance abuse problem is get the colleague to stop seeing patients, period. That means you tell them to stop seeing patients, forbid them to see patients, or interpose yourself so they can't see patients. Why? Stopping harm is always the first injunction. After you get them so they're no longer seeing patients, you must report them. If it's a resident, report them to the local hospital administration. Think maybe the program director. If it's a physician in private practice, you report them to the state medical board. Please note, this is an and, not an or. You will never say, stop seeing patients or I'll report you. The only possible answer is you must stop seeing patients and I have to report you. Both things have to happen. And then, wait, you're not done yet. Because now that you've stopped them from seeing patients, now that you've made the requisite report, now you must get them into treatment. Your colleague has a substance abuse problem. And substance abuse is a medical condition, amenable to treatment. So let's get them into treatment. Now, we haven't talked about this, so let's do so now. How do you get somebody into treatment? How do you get somebody into treatment, a colleague that has a substance abuse problem? Well, you don't suggest they go to treatment. You don't refer them to treatment. The right verb is you take them to treatment. You say concretely, get in the car, I'm driving, let's go. What if you don't live anywhere where there's good substance abuse treatment? That's easy. Then you buy 2 plane tickets. They get the window seat, you get the aisle seat, and you fly there with them. You take them for treatment. They need care. You're going to treat them as any patient by helping them get the care they need. If your colleague is discovered to have a substance abuse problem, is this person going to lose their medical license? The answer is no. If they go to treatment, do what we call working the program, stay in treatment and supervision, they're going to be allowed to continue to practice medicine as long as they stay in their treatment. We know this because in the United States today, surveys suggest we have roughly 20,000 physicians who have substance abuse problems. These are the ones we know about. They're all practicing medicine because as long as they are able to be abstinent from their substance abuse, as long as they're able to be working the program, we allow them to practice medicine. Yes, as you suggest, there are some limitations to their prescription privileges, but they're still allowed to practice medicine. They have a good living. If you have a colleague who's found to be sleeping with his or her patients, are they going to lose their medical license? Absolutely yes, because sleeping with your patients is considered a character flaw and therefore non-treatable.